HIV disease is one of the diseases that have attracted a lot of misconception about its means of transmission. There is this erroneous belief that when a person is diagnosed of HIV, the individual could be promiscuous. Hence, this erroneous belief is hyped when the sufferer is a woman. Why is that so? That is because in Nigeria and in Africa, women are seen as workers at home, sexually preserved just for their husband. Hence, when a woman is diagnosed of HIV, there is this erroneous belief that this woman could be promiscuous, and so she is paying for her sins. The advent of antiretroviral drugs has made it possible for HIV not to be a death sentence, rather to be a terminal disease. That is why adherence to antiretroviral drugs could make the individual to live as long as the individual wishes. But it has been observed that women living with HIV do not still adhere to these antiretroviral drugs despite its efficacy. Why is that so? This study is geared towards finding out factors that could be responsible for non-adherence of antiretroviral drugs. Is it social factors or psychological factors? The study looked at HIV-related stigma and depression as factors responsible for non-adherence to antiretroviral drugs. At the end of the study, it was observed that depression was a factor responsible for non-adherence to antiretroviral drugs. That could be so, since women living with HIV are being seen as women who are already dead. Hence, the shame and the sadness in their hearts could make them not to even adhere to antiretroviral drugs, because as long as they adhere, they will continue living and facing the shame. And so they feel like death would be the best option. So individuals could decide not to adhere despite the efficacy of antiretroviral drugs. Hence, this study projects that government should look beyond the provision of antiretroviral drugs and look at the mental state of these women living with HIV. There is need for government to provide adequate psychotherapy sessions for these women, not just providing antiretroviral drugs, but to look at their psychological well-being. Make sure that they are taken care of psychologically so that they will live to continue taking these antiretroviral drugs and be happy to know that their condition is not the end of their life. Hence, this study is viable and is beneficial for Nigerians. Thanks.